Mysterious newly discovered disease, which affects mostly homosexual men.
It's the CDC announcing immediate screenings for a new mystery virus from China.
One epidemic in history shows what happens and how many lives can be lost when the government is slow to respond to a health threat. The HIV/AIDS crisis. But is it a fair comparison to the coronavirus? COVID-19 and HIV/AIDS presented similarly in the beginning. Asymptomatic spread moving silently through cities, leaving a trail of pneumonia patients. The first government report showing evidence of the HIV outbreak was published on June 5, 1981. A full year later, NBC Nightly News reported on the mysterious illness.
Scientists at the National Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer.
At that point, the disease was spreading rapidly through New York City and San Francisco's gay communities. People were afraid to touch sick patients or even those they thought could potentially be sick, wondering if this disease people called, quote, the gay plague spread like the flu. On October 15, 1982, more than a year after the first HIV/AIDS patient was diagnosed, nearly 600 cases confirmed in the United States, and a 41% mortality rate. For the first time, the White House addressed HIV/AIDS, answering a question about the epidemic at a press briefing. A year and a half later, the U.S. government making an announcement.
The probable cause of AIDS has been found.
The blood test for HTLV3 will be ready in 6 months.
Like coronavirus, AIDS patients often died alone without their families. But they also faced the stigma against the disease alongside the fear of the spread, something Dr. Anthony Fauci pointed out early in the crisis.
The fear of individuals who either have AIDS or at risk group for AIDS, transmitting AIDS, is a understandable fear, but really might translate into uncalled for discrimination, which unfortunately has been the case.
Fauci became the director of the National Institute of Allergy and Infectious Disease during the HIV epidemic, a position he's held up until today. A promise of a vaccine by 1986 never came, so the U.S. moved to mitigation tactics. Today, the Trump administration, which has been accused of acting slowly, wavers on taking measures to combat the spread of the virus, like wearing masks. The CDC advises people to wear face coverings. But President Trump hasn't worn a mask, except on one occasion while at a Ford plant, although he refused to wear it on the public part of his tour. President Ronald Reagan mentioned HIV/AIDS for the first time in 1985 and delivered his first major policy speech on the crisis in 1987.
Our battle against AIDS has been like an emergency room operation. We've thrown everything we have into it.
He suggested abstinence to slow the spread, but not another important barrier, condom use. And while people knew HIV was sexually transmitted, it also spread in a more sinister and covert fashion in blood transfusions. By 1991, nearly 10 years since the first whispers of the coming health disaster, 100,000 had died of AIDS-related causes. The news buried on page A18 of the New York Times. By then, LGBTQ citizens were rallying, protesting with ACT UP, begging and demanding the country's leaders to invest in research for treatment, vaccines, and a cure. Led by Larry Kramer, a bombastic organizer credited with pushing the AIDS pandemic to the national spotlight. Anthony Fauci, you are a murderer, he wrote. Yet Dr. Fauci still grew to admire Larry Kramer.
He was a most unusual figure in the very positive sense. He was a firebrand. He had extraordinary courage to speak out and challenge the system that was in place at the time of the early years of HIV/AIDS.
Today, after well over 120,000 deaths in the United States from coronavirus, the protests were less about fighting the disease and more about reopening, getting back to normal. Unlike coronavirus, HIV now has proven treatments, but still, HIV deaths in the U.S. hover around 15,000 people a year. And the Joint United Nations program on HIV/AIDS says up to 770,000 died of AIDS-related causes in 2018. We're almost 40 years into the HIV/AIDS crisis. With COVID-19, can we do better?
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.